Honorable members, we'll be led in saying the Our Father prayer by the Honorable Member for St. Barnabas.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever. Amen.
Brad Mitchell, Glennis Hannah Martin, Alfred Sears, Michael Darville, Dr. Michael Darville, Clay Sweeting, Keith Bell, Wayne Monroe, Vaughn Miller, Jobeth Pony Davis, Ginger Moxie, Mario Boleg, Jomo Campbell, Basil McIntosh, Miles LaRoda, Pia Glover Roll, Lisa Ramming, Zane Lightborn, Dr. Hubert Minnis, Jamal Strawn, John Pinder, Marcus Roll, Leon Lundy, Kirk Cornish, Wade Watson, Leonardo Lightborn, Leslie Miller Bryce, Leroy Major, Sylvanus Petty, Mikel Bonnaby, Michael Pintard, James Kwesi Thompson, Aram Lewis, Shannon Dawn Cartwright, Adrian Gibson, Adrian White, Kingsley Smith.
Good morning, honorable members. Morning. Honorable members, I'd like to turn your attention to the gallery, where we have summer students who have joined us for the month of August. And this is our first time as the Parliamentary Commission, where we would have summer students we had last month and this month. So welcome to the House of Assembly. And with them, we have Mrs. Antoinette Clark, who plays a major role in the development of our Human Resource Department. Now we will go down the order of business as we conduct the people's business. Introduction and swearing in of new members, laying of documents by ministers. Thank you, honorable member. Statement and communication by ministers. The chair recognizes the honorable member for Caroline, Rumpke, and San Salvador.
Yeah. Madam Speaker, last week, the world paused to listen to the International Court of Justice. And for the first time, I add, in a very long time, the world heard with clarity what they had been hoping, asking, and demanding. We can all agree, whatever our politics, whatever our profession, whatever our standing or calling, that the Bahamas has a God-given right to survive, to live in safety, to fully enjoy the earth we occupy, to raise children without fear, that the next storm, the next flood, the next silent rise in sea level will erase what generations have built. The court confirmed that this is not simply an emotional claim. It is a legal one, and that matters. It matters to the family in Moores Island, still recovering from Hurricane Dorian.
Yes.
It matters to the children in Maguana, learning about climate change, not from textbooks, but from their own lived experiences. And it matters to us here in this chamber, tasked with the highest responsibility of all, to defend the right of our people and our nation to exist. Madam Speaker, the court ruling confirms that states, countries, have legal obligations under international law to protect the environment. That failure to reduce emissions, failure to regulate polluters, and failure to assist those harmed by the climate crisis are not acts of omission. They are breaches of law. This is not just a scientific judgment, although the science is clear. It was not just a moral appeal, although the moral case is overwhelming. It was a legal finding built on decades of treaties, legal principles, and growing recognition that the damage done to small island states like ours is not theoretical. It is real, and it is unjust. Madam Speaker, I would ask the House to reflect on what this means for a country like the Bahamas. We are a nation built on coastlines, on low-lying land, and on fragile ecosystems. Every flood, every storm surge, and every piece of coral lost to warming seas chips away at the physical foundations of our country. But it also chips away at something deeper, our confidence that we will be able to hand this place, these islands, to our children as our parents handed them to us. We were hit by 4 major storms, Category 4 and Category 5, within just 1 decade. Every hurricane leaves us less fiscal space to invest in our people, our economy, and in our future. Think about what happens when these massive storms wipe out homes and schools and roads and businesses and hospitals and electricity lines. The impact to our economy lasts for a long time. We lose revenue. Then we have to borrow to recover and rebuild, which increases our debt burden. At least, Madam Speaker, 40% of our national debt is directly attributed to the loss and damage resulting from these hurricanes. Then, as the size of our debt grows, we pay higher interest rates. And the risk of future hurricanes is priced in as well. Insurance premiums are higher, and our interest rates would be lower if those who hold our debt were not worried about the most intense storms coming our way. We are paying for storms we have suffered through, and we are paying for the storms of the future as well. As an administration, we have worked hard for fair climate finance because we want to exist. We want to exit from this climate debt trap. We want to use our resources to invest in our people and our future rather than in recovering and rebuilding. That is why this ruling matters, because for once, the law sees what we see. For once, the law speaks the truth we live with every day. Madam Speaker, I must take a moment to recognize the efforts of the Honorable Attorney General, Ryan Pinder Casey. his submissions to the court. You ought to be proud of him, man. He appeared before the court. His submissions to the court were thoughtful, grounded in the lived experience of our people, lengthy and robust. He did not stand alone, I must add, because you have another Bahamian voice there, our ambassador, Cheryl Bazard, representing the Organization of American States, who brought a Caribbean voice and a Bahamian sensibility to those proceedings. Two Bahamians, Madam Speaker, before the world's highest court, giving voice to a cause larger than any one country, but rooted in our own story. I want to thank our Attorney General for his advocacy before the highest court in the world, and of course, our Ambassador Bazard, who represented the Caribbean and the Organization of the American States for their sterling job before that court. No doubt their voices helped to persuade the court to the findings that they arrived at. It is often said, Madam Speaker, that small countries must shout to be heard. Last week, we were heard, not because we shouted, but because we spoke with clarity, honesty, and purpose. The ruling is advisory and not binding. That must be acknowledged. But its authority is unquestionable. It draws from the entire body of international environmental law. It provides guidance to future courts, and it offers countries like ours a firm foundation on which to build our case, make our demands, and exercise our diplomacy. Yes. It confirms that climate change is a human rights issue, yes, that the right to life, to housing, to health, and to culture are all affected by environmental degradation, and that those who contribute most to the problem must shoulder the burden of solving it. We're not asking for special treatment. We're asking for fair treatment. We're not asking for favors. We're asking for the law to be upheld. And we're not seeking confrontation. We are seeking justice. Madam Speaker, this ruling changes the conversation. No longer can support for climate adaptation be seen as aid. It is a responsibility. No longer can compensation for loss and damage be described as a moral gesture. It is a legal consequence. And no longer can the right of nations like ours to exist be treated as negotiable. It is fundamental. We're not the cause of this crisis. We did not build the factories or dig the coal, but we are facing the consequences: rising tides, lost shorelines, salt intrusion, vanishing fisheries, and broken infrastructure. We now have a legal basis to say to the world, this is not acceptable. This cannot go unanswered, and this must be addressed in the framework of law, not charity. Madam Speaker, this ruling must inform our foreign policy. It must shape our climate diplomacy. It must guide our engagement at COP negotiations and in every bilateral discussion where the question of climate justice is on the table. But it must also inform our domestic choices. We cannot demand action from others and remain static ourselves. We must continue to invest in climate resilience, strengthen our disaster response, protect our marine resources, and shift our own systems towards cleaner, more sustainable practices. Not because we are to blame, but because we are determined to survive, not as victims, as leaders. Madam Speaker, there will be those who say that nothing changes, that the emitters will continue, that the global system will delay, that the oceans will still rise. But something has changed. A principle has been clarified. A truth long whispered in back rooms has now been spoken aloud in the grandest courtroom in the world. We have a right to survive. That is not rhetoric, that is now law. And it is our duty, this Parliament's duty, to ensure that that right is protected. Let us go forward then, not with anger, but with resolve, not in bitterness, but in justice. Let us take this ruling and build with it policy, diplomacy, and action, so that when our children ask us what we did at the moment the law spoke, we can answer with confidence. We listened and we acted. Thank you, Madam Speaker.
Thank you, Honourable Member. Order that the communication be brought up. Oh, the spring. Spring. Thank you, Honourable Member. Order that the document be brought up. Thank you.
And powerful voice at those proceedings, represented by our Attorney General and Ambassador Prasad. Okay.
Thank you, Honourable Member, and my congratulations go out to both of them for representing the Commonwealth of the Bahamas. Order that both documents to lie on the table. Further statement and communications by ministers.
Thank you, Madam Speaker. Madam Speaker, I rise this morning to give a tribute and to extend condolences also to the member for Central Grand Bahama on the passing of Harvey Tynes KC, his father-in-law. While we mourn the passing of Mr. Tynes, we knew him as an exceptional legal mind and a fearless advocate, and someone who has been touted as a true patriot. His commitment to justice and the rule of law left an indelible mark on the Bahamas. Mr. Tynes was not only a brilliant jurist, but also a voice of reason and courage in times that demanded clarity and conviction. So on behalf of the government, we say that may his legacy continue to inspire generations of legal professionals and public servants. May he rest in peace. We extend condolences to the entire family, especially our colleague, Mr. Lewis, who sits in the chamber with us, and his entire family. May his soul rest in peace, rise in glory.
Thank you, Honourable Member. The Chair recognizes the Honourable Member for East Grand Bahama.
Thank you very much, Madam Speaker. Madam Speaker, I also wish to join and to speak on behalf of the Free National Movement, those of us on this side. We also wish to pay our condolences to our colleague from Central Grand Bahama, as well as to the family of Harvey Tynes, his wife Ingrid, and his daughters. Madam Speaker, Mr. Tynes was in set with my father, James Thompson, and one of a number of senior lawyers in Grand Bahama. And I can recall going in and out of his law office. I can recall many times attending their house for dinners, and his family attending our house, coming to play tennis and fellowshipping. Madam Speaker, he was a giant in the legal profession. And as a young lawyer, sitting with him, I can recall a case where, he used to have to travel from Freeport to Nassau. And I can recall sitting with my father in the case against him. And it really epitomizes the attitude that senior lawyers had, where they could argue fiercely before the court. They could argue a number of points fiercely, and if you didn't know them, you would think that they are at each other's throats. But the ironic thing about it was they were such good friends that at the end of the time that they spoke, they would get in the same taxi and drive to the airport and have to fly back to Freeport, and they would again be the best of friends and the good friends, Madam Speaker. The day Mr. Tynes died, we came on the same flight along with the member for Central Grand Bahama. And we had a heartfelt, meaningful conversation. And that speaks to the fact that you never know when will be the last time that you get to speak to someone. And he shared some things. He had a fierce loyalty for people. A fierce loyalty. He was loyal to the member for Central Grand Bahama, his son-in-law. He was fiercely loyal to some of us in this place. And so, Madam Speaker, when you had him on your side, you had him on your side. But if he wasn't with you, he wasn't with you. But, but Madam Speaker, I grew up with his daughters. They themselves now are going through their own challenges. We pray for them. His daughter, one daughter who is in the UK, I believe two are now in the UK, and they have their challenges. And we most certainly, I know on behalf of myself, my wife, my family, my father, my mother, on behalf of the leader of the opposition, Michael Pintard, and all of us on this side, we are praying for his family. We are praying for Ingrid, praying for the rest of the daughters, the entire family. We support them. We are praying for the member for Central Grand Bahama, and we are supporting him. So again, on behalf of all of us, our heartfelt condolences.
Thank you, Honourable Member. The Chair recognizes the Honourable Member for Cat Island, Rumkey, and San Salvador.
Speaker, it would be remiss if I were not to lend my voice to the chorus of condolences being expressed on behalf of a friend, a confidant, and a warrior in the vineyard of the legal profession, in the name of Harvey Tynes. Speaker, he was the Tynes, Hannah, hasty lineage, hailing from the great island of Acklins. I met Harvey, I suspect, in or around 74, 75. He had been admitted to the bar. Can't remember the year it was. Yeah, 75. I was admitted to the bar around the same time. 75. But my journey in the study of law was in the chambers of Wallace Whitfield and Banwell. And there was a stage in my career that Sir Cecil, as he then was attempting to have me work with him in his chambers. But I was already wanting to be free from, just be on my own, and I was then already committed to Hubert Ingram, and firstly, and then Barry Christie when he came along. Therein formed the firm of Christie Ingram, and then as it later morphed to where it is today, Davis & Co. And I met Harvey, because that's where he joined Sir Cecil in his chambers. And he was junior to Sir Cecil for years. I was an associate in his firm until he went on his own. I could always say that he was quite the character. He was witty, he was funny, but oh boy, as the member for East Grand Bahama said, that if he's with you now, he's with you, and if he isn't, you never want to be on the other side of that, what I call sharp tongue and aggressive. He took no prisoners when you are at war with him. And but he had a heart. He was compassionate, and he was a fierce advocate for the poor. And he never forgot from whence he came. Yes. Despite how he would have climbed into profession, and despite how successful he became, he always remembered Udall Corner. And it was so ironic that hours before his passing, or even an hour before his passing, the last spot he was in was Udall Corner. He came in that morning from Grand Bahama for the purposes of getting a checkup with a doctor. But when he landed, he told his daughter, before I go anywhere, I want to do two things. I need to get some Climat. I like my Climat. When I go to Cat Island, I go to my Auntie Tree. God bless her soul, she's just passed. She had the sweetest Climat tree on Cat Island. So when I go down this weekend, I go straight there, get my fill of Climat. He went to Udall Corner. That morning, his daughter took some Climat. And then his next stop was to go to see his sister, Edna Ejoma. And I'm very familiar with the whole family. In fact, I had not seen Edna in years, only to run into her a couple of weeks ago when we had the occasion to fellowship and talk about the old times and her Cyril. And she was telling me about her vacation she was going on. And she's on vacation, and I don't know that Harvey knew that, because I think he was going to try to surprise his sister and visit her. And on that journey, he passed away. And so he still wanted to climb his Climat tree. That speaks to who he was. And very often, you would see him flying in the face and even, pressing the envelope to stand up for the right of another person. He could not stand by and see a vulnerable person being taken advantage of. I saw it myself in him. Even if he's walking down the street and he see a bullying someone, he wanted to get in that bully face and say, pick on somebody your size. See me here. Now he wasn't big now, he was just short. But that's the nature of the man. And so I had the occasion to speak to Ingrid. I had the occasion to speak to Nisha and to convey my condolences. But he's going to be sorely missed. And it was a shock to me because the profession has lost quite the advocate for the disadvantaged in this country. The country has lost someone who understood what it meant to not forget from whence you have come. Now, some say he was very arrogant. I say, no, he was not arrogant. He was just confident, and he had the conviction of his belief, and he pursued that conviction without fear, without favor. And as I said, and whoever's in that way, he will clearly from out of his way. I want again to convey my sincere condolences to his son-in-law, a member from Central Grand Bahama. I spoke with him on the morning, and he gave some of the update as to what had happened. And I convey my condolences to you, Iram, and to the family on an untimely passing of a great advocate for the poor and a good exemplar for understanding that regardless of where you started in life, you're only limited by your own circumstance if you allow it. You could climb to the top, but also from climbing the top, don't ever forget from whence you came. That helps you to be the better person and the person that we speak of this morning. Thank you. May his soul
Thank you, Honourable
rest in
Member.
peace.
The chair recognizes the Honourable Member for Central Grand Bahama.
Madam Speaker, and I want to say thank you all for your words, East Grand Bahama, and to the member for Cat Island and Rumkey. I have not lost a father-in-law, I've lost a father, a good friend, an advisor, someone who I walk with every morning, except on Sundays, and after our walk, we go for a swim on Coral Beach. So the moments of reflection and advice is really priceless. I want to say how grateful I am to my colleagues in this chamber, those who sprang into action immediately upon receiving the news. Member for Tall Pines, Angliston, Fort Charlotte, Exuma, East Grand Bahama, everyone just came and embraced me and gave me and the family the support that we needed at that time. And I can tell you, our walk through Sorrow's Valley is being that much easier because of the love and the support that you would have given to us via physical contact, telephone calls, and by any means. I want to say again special thank you to the staff. The Bahamian doctors are the best. I was saying to Dr. Indira Grimes, who was there, who was really an angel at that moment, who took over when Tanisha and I really couldn't stand on our own. But thank Angliston and East Grand Bahama immediately going to the hospital. Exuma loaned us his driving his car to get there as soon as possible. And like I said, everyone just came in and offered support. So more will be coming. I'll respect the details of the funeral. And to Cat Island, unfortunately, his sister, she is on vacation. She still doesn't know yet. Her children couldn't come to tell her exactly what's going on because that's her Harvey. And my daughter's also having a hard time because when Daddy's not home, Grandpa is there. And he was happy sometime when I'm not around, he said, I'm king, where she make me feel I'm worthy of being called Grandpa. So once again, on behalf of the family, I cannot express how grateful we are, and no matter what they say out there about us, the unity, the divide, the polarization just disappeared last week, and I believe that will continue. So that's an example that when we need to come together, we push our political differences aside and we come together. So thank you all again for the love and the support, and I will be updating the chamber as plans are made. So once again, thank you very much.
Thank you, Honorable Member. And Honorable Member, on behalf of myself and the staff here at the House of Assembly, we would like to express our condolences and wishing your family comfort during this time of bereavement. Further statement and communication by ministers. The chair recognizes the Honorable Member for Engliston.
Thank you. May it please you, Madam Speaker. Maybe I'll have another opportunity, but I can't get to my feet without joining all of the voices in condolences for Harvey Tynes, King's Counsel, such a iconoclastic figure, so distinguished in terms of his own personality and the way in which he expressed his presence on the planet. And there was no one like him. He's also family to me. We're from the Hannah Hasty Tynes lineage, and he always embraced me like a little sister or member of the family. And through all of my my public expeditions, particularly on the convention floor, he would always send encouraging words to me, and his loyalty is just unmatched, and his mind is brilliant, and a man who moved to the beat of his own drum. And so this is a huge loss to his family, because he's a very colorful and engaged personality in that family as a leader, but also to the nation and to his extended family. So I want to send condolences. Madam Speaker, I'm rising to lay two reports. If you recall, Madam Speaker, you referred on an urgent basis matters to the Privilege Committee on two incidents or exchanges that happened on the floor of the Parliament several weeks ago. And with your leave, I would like to, first of all, present the report of the Committee of Privilege on the matter concerning the Honorable Leon Lundy and Mr. Shannon Dawn Cartwright. He's not here, but I would like to lay it. He's here? Okay. Okay, he's in the precincts, I'm told. Yes. With your leave, may I proceed?
You may proceed, Honorable Member.
Thank you. Madam Speaker, present at the meeting was held the 23rd of July, 2025, Wednesday. Present was myself, Honorable Keith Bell, and Mr. Iram Lewis, Member of Parliament. Absent was Mr. Shannon Dawn Cartwright and Mr. Leroy Major. The missing members gave apologies for their absence, and a quorum was in place. Madam Speaker, on the 18th of June, 2025, two matters were referred to the Committee on Privilege. The committee has met and examined both issues, and its reports are as follows. The substance of the matters referred to the committee are as follows. At the conclusion of the Honourable Member for South and Central Andros's contribution to the 2025-2026 budget debate, certain questions were posed to him by the member for St. Barnabas concerning increased charges and rates of charges on water supply. The member for South and Central Andros gave an answer to the member, which the member did not accept. The member for South and Central Andros then tabled a document in support of his position. A dispute arose between the two. The following day, the member for South and Central Andros sought to further clarify the response he had given on the previous day. The member for St. Barnabas accused the member for South and Central Andros of misleading the House. He used more colorful language, which we will not refer to. In so doing, the member for St. Barnabas used words that the member for South and Central Andros found objectionable. The member for South and Central Andros complained to the chair and requested a withdrawal by the member for St. Barnabas. The member for St. Barnabas refused to withdraw. Other members became engaged in the argument, disregarding calls for order from the chair. At this point, the Deputy Speaker referred the matter to the Committee on Privilege. As the issues at stake involved matters of privilege and an amicable settlement between the two members could not be reached, the presiding officer referred the matter to the Committee on Privilege. Subsequently, the committee met and fully investigated the matter using transcripts from the Hansard and video clips from the House. The committee's findings are as follows. 1. The dispute arose out of the member for South and Central Andros's contribution to the 2025-2026 budget debate, which commences 1st of July 2025. His statements were about the transition from quarterly to monthly billing with the support of the smart readers. The member for South and Central Andros statements were futuristic in that regard. The member for South and Central Andros made this point when he addressed the matter in the House on the 19th of June 2025, the day after the dispute arose. The committee has had the opportunity to review the minister's statement and watch the video of the proceedings. The committee has found harmony in both sources of evidence. The committee has also examined the documents tabled by the member for St. Barnabas and found that they clearly refer to matters of the past and do not contradict the statements of the member for South and Central Andros on the matter, which was a projection of the government's fiscal policies commencing 1st July 2025. Conclusion. The committee found the request for an apology from the member for St. Barnabas by the member for South and Central Andros reasonable. The committee found the words used by the member for St. Barnabas to be unfounded or unsupported, and in the circumstances, unwarranted. In the circumstance, it is the view of the committee and its recommendation that the member for St. Barnabas take the high road and apologize to this House for accusing the member for South and Central Andros of deliberately misleading the House, as the evidence he used to support his claim failed to do so. On examination, those documents were irrelevant to the discussion. And it's signed by myself, Honorable Keith Bell, and Hiram Lewis, Central Grand Bahama. The second report of the Committee of Privilege on the matter concerning Honorable Miles LaRoda and Mr. Adrian White. Absent again, both matters were dealt with in the same sitting, were Mr. Shannon Dawn Cartwright, Mr. Leroy Major. Present were myself, the Honorable Keith Bell, Mr. Hiram Lewis, and the missing members gave apologies for their absence, and a quorum was in place. Madam Speaker, the substance of the second dispute referred to the committee are as follows. During his contribution to the 2025-2026 budget debate, the member for St. Anne's, Mr. Adrian White, displayed a poster-sized photograph purporting to show a cabinet minister's vehicle parked in a slot reserved for disabled persons. While a small photo of the minister whose vehicle was illegally parked was in fact on the poster, a larger-than-life photo of the Member of Parliament for Pinewood, Minister Miles LaRoda, dominated the display, making him the subject of the photo and suggesting that he was the minister whose vehicle was parked in the slot reserved for disabled persons. The following day, Minister LaRoda rose on a matter of privilege and complained to the chair about the deceptive and unfair tactics that had been used by the member for St. Anne's. Again, an argument erupted between members that could not be settled on the floor of the House, as members were unwilling to concede their positions or the actions they had taken. This too was sent to the Committee on Privilege. The committee met and examined all of the relevant evidence and found as follows. 1, the member for St. Anne's did in fact display a poster in the House as set out in the claim. 2, the poster was designed in such a way as to make the member of Parliament for Pinewood the subject of the poster, when in fact he had nothing to do with the matter under discussion. Conclusion. The committee is of the view that the design of the poster was a deliberate attempt to bring the minister's reputation into odium and contempt. The committee has no doubt that the member for St. Anne's was deliberate in his actions. The committee is of the view that the member for St. Anne's should apologize to the Member of Parliament for Pinewood, and indeed to this House, for his acts of deception. Finally, Madam Speaker, it is the view of the Committee of the House It is the view of the committee that the House should take matters of this nature more seriously, and formal resolutions of condemnation should be agreed by the House in any future acts of deliberate deceptions of this House or the viewing public. Thank you, Madam Speaker.
Thank you, Honourable Member. Ordered the reports be brought up.
What, today is the 30th, 31st, 30th? Thank you.
Thank you. Order that the reports do lie on the table. Thank you, Honourable Member for Engliston, and the Chair will take advice as we move forward with those recommendations. The Chair recognizes the Honourable Member for East Grand Bahama.
Thank you very much, Madam Speaker. As both of the members are not in the chamber, we would just ask for an opportunity for them to review the ruling, and then they will make their comments after they've had an opportunity to review it, and then they will do it. So we are only asking for an opportunity for them to review it, and then they will make their comments afterward. That's all we're asking for, an opportunity to review it, and then they will make their comments.
Thank you, Honourable Member. And remember now, that is the report of the committee. It's not a ruling. It's not a ruling. It is a report of the committee and their findings, and they can view it, and I will ask both members upon their return to these chambers if they are willing to comply with the report. Further statement and communication by ministers? The Chair recognizes the Honourable Member for Killarney.
Very much, Madam Speaker. Madam Speaker, I stand to extend condolence to the family of Harvey Tynes, Ingrid, the kids, on behalf of myself, my wife, and the Killarney constituency and my entire family. Harvey and myself go way back, Madam Speaker, and it was four of us who always hung out together and essentially knew everything about the other. And that was Harvey Tynes, Dr. Philip Thompson, Slimy, now deceased, Dr. Robin Roberts, and myself. We were like family, and in many instances like brothers. And I used to spend a lot of time with the Tynes family in Grand Bahama anytime I visited. So I watched the kids grow up from infant to become adults. And Happy and I were like brothers, and therefore the kids were like mine. So I must extend also to my unofficial in-law, the member for Central Grand Bahama, who is married to one of Harvey's daughters. So I extend condolence to him also. Harvey was an outstanding lawyer, a great QC, and believe me, I would have consulted him in many legal matters. Sometimes he can be a bit rash, but you have to dampen the words that he would give you, because those words could only be repeated between us four. But he has made great contribution to this country, and I'm certain that he would be greatly missed, not only by the Bahamas, but by other legal colleagues who would have schooled with him in his law qualifications. Thank you very much, Madam Speaker.
Thank you, Honourable Member. Further statement and communication by ministers?
It's Madam Speaker.
Thank you, Honourable Member. Communications by the clerk? Please.
Madam Speaker,
I like that.
I beg leave to report delivery of messages numbers 42 and 43 to the Honorable the Senate.
Thank you, Honorable. Thank Messages from the Governor General. Messages from the Senate. Honorable Member. We have a message from the Senate, number 29, as in reads, message to the Speaker and members of the Honorable House of Assembly from the President and Honorable members of the Senate. The Honorable Senate acquaints the Honorable House of Assembly that they have passed the following bills accompanying messages number 42, dated 16th July 2025 from the Honorable House of Assembly. A bill for an act to make provisions for the registration of titles to land and for dealings in land so registered and for purposes connected therewith. A bill for an act to provide for the systematic adjudication of rights and interests in land within the Bahamas, the demarcation of boundaries and matters connected therewith. It is dated 28th July 2025 and is signed by Senator the Honorable Darren Pickstock on behalf of the President. I now lay that document on the table. Motions for leave of absence, leave to resign seat, and new writs. Presentations of petitions. Presentations of reports of committees. Adoption of reports of committees. First reading of bills. The chair recognizes the honorable member for Tall Pines.
Thank you so much, Madam Speaker. I, too, would like to join the House in extending my deepest condolences for the member for Central Grand Bahama, and by extension, the entire Tynes family. Grand Bahama has definitely missed a giant of a man, and his contributions to that island will go down in the annals of history for many decades to come. I also would like to join the Prime Minister in congratulating our AG, the Honorable Ryan Pinder, and on the job well done, along with Cheryl Bazard. I think the ruling is a very substantial ruling by the International Court of Justice. But I want to just take a few moments because I know the Prime Minister can't blow his own horn, but I've had the opportunity to travel with our Prime Minister as an international climate champion who has led the charge for small island development states and the impact of climate change to our geographical location. I could distinctly remember his contribution in COP29, where he received a standing ovation from the Commonwealth heads of government and leaders from around the world for the great work he has been doing on the international stage in climate change. I'd like my colleagues to join me in giving our Prime Minister a round of applause. Madam Speaker, this morning I rise with a deep sense of gratitude on the shoulders of the great people of Tall Pines to lend my voice to this important debate. This time, to a compendium of 5 non-contentious health-related bills designed to strengthen and modernize healthcare protection and public health, expand equity across every aspect of our country. After extensive consultation, we in this side are confident that these bills would meet the needs of the Bahamian people today while preparing our country and our young people for the demands of our healthcare system for tomorrow. Madam Speaker, the 5 bills that make up the compendium of health legislation are the National Health Insurance Bill 2025, the National Health Insurance Chronic Disease Prescription Drug Fund Bill 2025, and the Health Promotion and Wellness Bill 2025. Also with this compendium is the Dental Professional Bill 2025 and the Pharmacy Amendment Bill 2025 together represent a comprehensive health reform package ideal for our archipelago, where the logistics and navigation and land and sea demand is absolutely a challenge, which required well-regulated healthcare services and policies. Today, my time would be limited, but I intend to speak briefly on each piece of legislation. Madam Speaker, the health system that we inherited a few years ago was neglected, under-resourced, increasingly unable to meet the demands of a population affected by the increased incidence of chronic non-communicable diseases, outdated legislation, limited provider access, and the mounting financial costs that affected all of the healthcare agencies.
That's the foundation right there. That's where you start.
Absolutely. I cannot overemphasize the fact, to change clinical outcomes of our patients, we must change healthcare policies and upgrade healthcare delivery systems. If we are to ensure that our children and grandchildren have access to affordable, quality healthcare, then legislative action is required that would act as the catalyst to bring the positive change reaction in my ministry that will promote essential reform. Madam Speaker, let me begin this debate with the centerpiece of this legislative package, the National Health Insurance Bill 2025. This bill seeks to repeal and replace the National Health Insurance Act 2016, which served us well, but is unable to take us into the 21st century. This new progressive bill creates the essential unified legal framework for the delivery of national health insurance, moving the Bahamas closer to universal health care coverage as outlined in the United Nations Sustainable Goal number 3, good health and well-being for all at all ages. Since the establishment of NHI in 2016, over 161,000 Bahamians have enrolled nationwide, with 17,000 in the Family Islands and just over 27,000 in Grand Bahama, all who are receiving free primary health care services by a family doctor of their choice. Patient satisfaction for NHI stands above 90%, and public support for this program is bursting through the seams at 95% and growing. The Bahamian people want national health insurance. A nationwide electronic medical record system has been implemented, which proved vital during the COVID-19 pandemic and continues to support telemedicine and data-driven decision-making platforms. Yet, global healthcare services remain costly, and the financial barriers remain a reality for thousands of Bahamians across the country. Many Bahamians still delay or avoid care because of costs and accessibility mainly on our Family Islands. Madam Speaker, let me be clear. This David Lair's administration believed no one should experience severe financial hardship alone while trying to stay alive and to get medical care. Therefore, this new bill seeks to address many of these real-life challenges that Bahamians face every day. Madam Speaker, the bill defines the standard health benefit package, guaranteeing primary care, maternal and pediatric services, diagnostics and lab, health education and promotion, screening programs for cancer and other specified conditions for every Bahamian, regardless of income, geographic location at no cash at point of service. Part 2 of this bill designates the National Health Insurance Authority's functions and powers as the primary funder for public and private care, aligning incentives so that money follows the patient. This new NHI Bill 2025 creates clear governance structures and funding streams to ensure transparency, fiscal responsibility, and long-term sustainability. This bill expands the providers' network so that Bahamians on our family islands can accept and have access to these standard basic packages, and not only those in New Providence and Grand Bahama, but across the archipelago. The bill also allows for the expansion into prescription drug coverage and selective catastrophic care, such as dialysis and cancer treatments. And finally, the bill unifies enrollment, claims processing, timely payment to providers, reducing paperwork by an estimated 40%, cutting claims turnaround in half. This bill, Madam Speaker, is the result of extensive consultation. I want to say it again. Extensive consultation. And we have adjusted what we propose to the relevant sector and modified the model to what you have seen in the bill as presented today. Since 2022, we have held formal discussions with public and private key stakeholders, including but not limited to the Medical Association of the Bahamas Insurance Association, and the Insurance Commission of the Bahamas, and the general public at large. Key points of emphasis from the consultation sessions include the importance of explaining expected revenues to physicians, greater clarity in the type of insurance plans impacted, and the need to continue to ensure that the program is designed to be accessible and affordable for all Bahamians. The National Health Insurance Bill 2025 addresses gaps in the past and places the health of the Bahamian people at the center of our policy. Madam Speaker, in the Tribune on Thursday, July the 24th, an article done by Neil Hartnell spoke specifically about the bill itself. And in this article, he was interviewing Mr. Boslan, who is the deputy chair of the Bahamas Insurance Association. And I want to read some of this article and adopt it as my own words, and will lay this document before the end of my contribution. Mr. Boslan explained yesterday that the Bahamas Insurance Association and its members are largely in favor of the NHI reforms, and he added, I don't think the changes I do think that the changes make sense for the Bahamas, and the 1 year gives significant time for adjustments. In the insurance industry and the Bahamas Insurance Association itself support the legislation. The legislation is not perfect, but we support it. Everything will likely have to change a lot. Asked whether there has been a sufficient consultation with the government, Mr. Boslan explained, it seems like a good initiative. We think, Pardon me? Yeah, absolutely, I did. I know this is fine print, man. As you can see, you see what kind of print I have to read from. Yeah. We think that it's a step forward. We can always complain, but we did have sufficient time for the legislation. We were able to provide feedback in a timely manner. Because this affects insurance companies, we wanted time to review it. We did not get as much time as we would like, but the time was sufficient. The review was fairly easy, and all things being equal, we are comfortable the insurance industry was able to do an adequate review. The government took our comments into consideration, looked at every single one, gave feedback, and reported on everyone, and they were adjusted in the bill as outlined. The process was detailed, and we are satisfied with the results. And this is why I would lay, the article goes into greater extent. But ultimately, it clearly demonstrates that the Bahamas Insurance Association is satisfied with the consultation process and the adjustments that have made to the new bill that is laid in Parliament. Madam Speaker, the second piece of legislation, the National Health Insurance Chronic Disease Prescription Drug Fund Bill 2025, will repeal and replace the NIB Chronic Disease Prescription Drug Fund Act, which currently serves about 41,000 Bahamians. Managing chronic diseases like diabetes, hypertension, renal disease, and heart failure require more than just a doctor's visit. It requires continuous access to an affordable, high-quality medication. Under this bill, the NIB drug prescription fine finally is to be integrated into the National Health Insurance Authority, as foreshadowed by the Synergist report, the blueprint for universal health care coverage in the Bahamas, where now over 161,000 enrolled Bahamians benefit from a single access point for both medical and pharmacy requirements. This move would also eliminate the current practices that we see in our clinics where two pharmacy dispensaries are located on one clinic ground. This reduces the costs for providing drugs and eliminate the large amount of wastage. We have finally established a single national drug formulary after many years of hard work. With centralized procurement protocols, strategic supply contracts, and better price control mechanisms. Using digital health tools, we will track prescriptions used, support medication, and improve clinical outcomes for our patients. This means that Granny in Eleuthero managing hypertension and diabetes will now be able to access her doctor and get her medication on one digital platform. She will not have to worry about traveling from one location to the next and run the risk of interruption of care as a result of these long journeys. Similarly, a young man in Bimini with type 1 diabetes will have consistent access to his life-saving insulin. Pharmacy providers will see reduced paperwork and faster claim processing and pay in a timely fashion. We are pleased to report that an in-depth consultation with the industry was done prior to the laying of this bill, and much of the feedback is incorporated in this piece of legislation before the House today. Madam Speaker, the transition of drug treatment for chronic non-communicable diseases from NIB to NHI makes sense because it finally completes the model of care provided by NHI and moving closer to universal health care coverage and a one-stop shop where consultation, lab, diagnostic, and treatments are available. Again, the consultation process with providers, insurers, pharmacies, the Bahamas Pharmacy Association and Council, and other related bodies have had the opportunity to review the bill and incorporate many of their recommendations in this legislation. Madam Speaker, that bill is substantial and it has a variety of different clauses. The mechanics of the bill are straightforward, easy to read, easy to understand, And if there's any questions as it relates to many of the clauses, I will be willing to speak specifically to them, but to assure the Bahamian people that there has been both private as well as public participation, and many of those affected from this piece of legislation have given solid input, and now we feel that we are ready to move. Madam Speaker, recognizing that medical care alone cannot solve the public health crisis driven by poor diet, sedentary lifestyles, and environmental risk factors, this third bill, the Health Promotion and Wellness Bill 2025, aims to shift our national agenda from treatment to prevention and holistic well-being. Madam Speaker, the result of my ministry's most recent STEP survey report in 2025, combined with the Global School Health Report, revealed that our adults and children are overweight, and our teenagers are already at risk for obesity-related diseases. Non-communicable diseases account for the majority of premature deaths in the Bahamas, and our suicide and depression rates are of great concern to us in the Department of Public Health. Putting my ministry on high alert, and with the need to bring into force other components of the new sophisticated Mental Health Act to address many of these mental health issues bubbling to the surface that is a direct result of shocks that many individuals have experienced over the last 10 to 15 years. This bill empowers the Minister of Health and Wellness to implement national health promotion and wellness plan that targets social determinants of health, such as education, the environment, and nutrition. It establishes the National Food and Nutrition Commission, something that we have been tossing with for many years that is vital, which will oversee food safety, regulate advertising, negative advertising, and restrict harmful imports of food laden with carcinogens, artificial sugar additives, and to keep our eye on genetically manipulated foods. Madam Speaker, let me give an example. Chemically manipulated trans fats, often found in partially hydrogenated oils, are used to improve taste, texture, increase the shelf life of the product, and is incorporated in many ultra-processed foods. These products are inexpensive, they're readily available, and have some of the most harmful products to our cardiovascular system. They have been linked with vascular disease, increased bad cholesterol, diabetes, and the proliferations of cerebral vascular accidents in the country. Many countries around the world have already banned them and greatly restricted these type of harsh and dangerous chemically manipulated trans fats. The same is happening with foods that are incorporating many of the food coloring additives. They are known to be carcinogens, and they are restricted and eliminated from some countries and some states in the United States of America. Some additives and food production processes have been linked to behavioral changes, particularly in children, mental health concerns in all age groups, and have been proven to even affect mobility in the elderly. This piece of legislation, we believe, is aligned with our administration 5% reduction on unhealthy food and healthy foods and prepared foods, giving families in the country a better access to fresh, affordable, nutritious foods. The fact is, when we really assess the breadbasket item lists that the side opposite holds so dear to their heart, it proved to be nutritionally limited, full of empty calories, proliferating much of the cardiovascular disease and diabetic conditions, And the foods that were not on that list incurred a 12% VAT under their watch. It left the people in the country asking many questions. What about fruits? What about vegetables, nuts, lean cuts of meat? And how would these foods that are high in carbohydrates and non-nutritious food help in our health and well-being? The side opposite like to harp on the fact that bread basket items had 0 VAT. But, Madam Speaker, 0 VAT times 0 nutritional content gives 0 future health benefits to our people.
0.
I put it to you that our administration looked at the vision for the future, and we remain focused on giving our people healthy choices. We will fight diligently to do it, and the 5% VAT reduction is a step in the right direction. I want to make it very clear that our administration have moved away from the narrow list of foods to reducing the VAT on whole foods that help families prepare meals that are nutritious for breakfast, lunch, and dinner, and even midday healthy snacks. Madam Speaker, this bill also mandates health in all policy approach, which bolsters collaboration among ministries such as agriculture, education, finance, tourism, youth sports and culture, urban renewal, along with non-government organizations and our obligations to the Pan-American Health Organization, the Caribbean Public Health Agency, CARICOM, community groups, and private sector partners to align policies with national health goals for best outcomes for our people. We want our people to eat healthy. We want to find a way to reduce the cost of food. And we want to try to find a way to keep the bad food that can precipitate poor outcomes away from our country. Last week, my ministry hosted a youth forum that brought together public and private stakeholders, along with our young people, to discuss how we can improve health environments in our schools, in our homes, and in our communities. The meeting was successful and solidified the fact that a multi-ministerial approach is not only cost-effective, will prove to be transformative. I believe everyone in this honorable place and everyone to the sound of my voice want to live long lives. But we also want to enjoy quality of life. We want to have clarity of mind. We want to make sure that there's physical well-being, and we live longer and more productive lives. Madam Speaker, with the implementation of this bill, it is our goal to teach healthy lifestyle practices in our homes, in our schools, in our workplaces, and train more of our people to be advocates for health and wellness. We want to prevent disease brought on by conditions that are usually preventable. We want early detection, annual screenings, mental health care, diet, nutrition, fitness education, management of NCDs, and self-care, which is to love yourself, to take care of your body, and be productive citizens in the country. We cannot and should not have to build and staff more healthcare facilities to treat diseases that are practically preventable. Instead, with progressive legislation, we are giving this generation and future generations to come the power and the legislative tool and teeth to live healthier, longer, productive lives. Madam Speaker, the fourth bill is the Dental Profession Bill 2025, which seeks to repeal the outdated Dental Act 1990 and introduce a modern regulatory structure for dentistry in the Commonwealth of the Bahamas. Poor oral health affects physical health and is linked to heart disease, diabetes, and respiratory infections. Therefore, we must ensure that our providers are well-trained, qualified, and treating the whole man. This bill has been vetted by the industry and providers for licensing and registration of all dental practitioners under unified international regulatory standards. It's designed to keep the rotten apples out. Individuals who are doing procedures who are not qualified. And the Dental Association approached us because there was no real teeth to go after them and to shut them down. It provides a different license issued for different practices and the qualification and eligibility required. The bill continues and empowers the Dental Council and maintains a comprehensive code of professional conduct, sets disciplinary procedures, and the scope of practice identifications. For persons seeking to specialize, the bill provides a list of the approved postgraduate training and certification institutions. The Dental Professional Bill now mandates that dental procedures and auxiliaries must continue dental education courses according to their level of specialty. Special permits for the administration of local anesthesia and deep sedation for patients eligible must be approved by the Council. As public oral health programs, dental services expand across our archipelago. This bill ensures that Bahamians, wherever they are, whether New Providence, Grand Bahama, or the Family Islands, will receive safe, professional oral health care. It also protects the practitioner by clearly outlining their rights, their responsibilities, and the regulatory obligations. This progressive bill was shared widely in the dental community and widely accepted in its current form that you see here today in this honorable House. I would like to take this opportunity to thank the Dental Council, the former Director of Oral Health, Dr. Mitchell Lockhart, for their inputs into this important bill. We believe that the bill is not only progressive, but provides the legislative teeth to regulate the profession and go after the rotten apples and those who are doing procedures in the country are not qualified to do so. I know the Medical Council, we have a strong regulatory framework, and I believe now that this bill that was drafted in 1990 or came into force in 1990 is long overdue to have these essential changes put into law so that the association as well as the council will be able to go after the violators. Madam Speaker, lastly in this compendium is the Pharmacy Amendment Bill 2025. This bill seeks to make a simple yet progressive amendment to update the law to recognize modern prescription practices in the country and to make sure we meet global standards. Through electronically transmitted prescription via a secure, authenticated e-prescription system, doctors and pharmacists can now treat patients via secure digital platforms. We see this in the United States with controlled substances. We see it in Europe. And now the Bahamas must follow suit to be able to have e-prescriptions. These changes keep pace with global best practices, enhance patient safety by reducing transcription errors, and enable pharmacies to verify orders in real time. This bill seeks to integrate what we are doing with our new NHIA digital platform and by extension, the Cannabis Act 2024 database, ensuring compliance, patient confidentiality, and safety. These amendments are especially important as we expand telemedicine and modernize hospital systems by way of e-clinical records. Madam Speaker, in line with our blueprint for change, we are not merely fixing what is broken. We are rebuilding a system so that it works for everyone. These bills reflect our commitment to build a resilient healthcare system that protects every Bahamian, whether you are a senior citizen managing a chronic disease, a single mother trying to become healthier, a student navigating through issues of mental health, or a practitioner serving in a remote clinic on one of our beautiful family islands. These reforms matter to them. By eliminating duplication, harnessing digital tools, and investing in prevention, we will reduce out-of-pocket costs for families, freeing up income for education, small business growth, and community development. We are planning to lower hospital admissions, long-term care needs, generating savings that families can reinvest in training, capital upgrades, and research. We cultivate a culture of wellness where healthy eating, regular screening, and oral hygiene become a commonplace as we are brushing our teeth. For the next generation, these reforms ensure that a child born today will inherit a system capable of detecting disease early, treating it affordably, and empowering individuals to live longer, more productive lives. Madam Speaker, before I take my seat, I would like to thank my technical team, our hard-working AG and his team, and finally our Prime Minister, the Right Honorable Philip Brave Davis, for his leadership and support. Madam Speaker, I invite honorable members in this House to participate in this meaningful debate that would improve healthcare delivery systems for years to come. These bills are not perfect. I've not seen a perfect bill since I've been in this honorable place. But these bills bring us closer to universal health care coverage by way of national health insurance, remembering that health care is not a privilege, but is a right. Yes. And with God's help and hard work, we will deliver a sustainable health care system now and for generations to come. I so move. Yes.
Thank you, honorable member. We had originally reached to first reading, so we are now celebrating second reading and committal of bills. That's right. We're celebrating that. And so I will now call for a seconder. The chair recognizes the honorable member for Golden Gates.
Thank you, Madam Speaker. Our member for Tall Pines, rightfully so, is excited to be able to provide what is going to be what is a strong compendium of healthcare bills that will benefit the people. And you know, I like to always say, it's always about the people. So I don't blame Tall Pines for his excitement in wanting to deliver on these bills. Madam Speaker, before I get into my debate, I want to wish a very happy birthday to Senator Randy Roll, who celebrates today. Also my Aunt Linda and cousin Michaela, who are also celebrating. I want to join in my good colleague from Tall Pines in congratulating the KCs, I call them. RAG, Mr. Ryan Pinder, my sister, I call her Cheryl Bazard, and of course, the great KC from Cat Island, Rumkey in San Salvador, for his unrelenting championship of climate action around the globe. This is indeed a moment that we should herald and be very proud of. So I want to stand in agreement with the member from Tall Pines in celebrating those KCs for the work they've done on climate action globally. Madam Speaker, as usual, I rise today giving glory and honor and praise to Almighty God for allowing this little girl from Baytown to be able to stand in this honorable place to represent when Baytown woman catch a fire, even the devil run. But Madam Speaker, I am grateful to God because I stand here to be able to represent some of the most wonderful people in the Commonwealth, and that's the people of Golden Gates, but also to serve the people of the Bahamas. It is a privilege. We in this chamber should all celebrate. We are in 0.1, I think it's 0.1% of the population that get to come through these halls, these chambers, and to represent the masses. And that's a privilege that we should not, and I know I do not, take for granted. So, Madam Speaker, glory and honor to God for this opportunity. I am also honored in this second reading to lend my voice by seconding this historic debate on behalf of the people, always the people, who have, and I say, you know, when I think of all of the constituents that are represented here in these chambers, we can all think of persons that we represent, who we have heard their stories. They had to choose between buying food or paying for medication. They had to choose between life-saving treatment and paying for a surgery that could have been, you know, very important for them to have and very urgent, or actually having to decide if they're going to pay their bills or if they were going to move forward with a surgery procedure that would save their lives in some instances. We've heard the stories as representatives in particular. Some of us may have lived those stories. For families, as a mother, Madam Speaker, with unwell children, we think of their stories. Precious babies who desperately need treatment and will now, as a result of this compendium of health bills, be afforded that treatment through the changes we are making here today. Madam Speaker, I am absolutely proud to be a part of this change because it's important when we come here to represent people that we think about the issues that affect the people we represent. The policies that we affect in these chambers should positively affect people. Policies should touch the lives of people. To stand behind the legislative changes that improve lives and touch the least amongst us is something that I feel is a privilege and an honor. So today, Madam Speaker, I give my unbridled support to this country-changing, life-altering compendium that will make a huge difference in the lives of thousands of Bahamians. And Madam Speaker, this is actually personal for me because in 2018, I was bedridden. I had spinal issues. I ended up in a wheelchair. I saw a few doctors who told me there was a distinct possibility that I would never walk again. It was thanks to a referral by Prime Minister Perry Christie that I was able to get a consultation that led to a successful surgery. And of course, the recovery was very challenging. I spent the next year in therapy, learning how to walk again. But I was able to pull through, Madam Speaker, thanks to God, because it's his report that I believed. Amen. But to excellent health care and excellent therapy. But Madam Speaker, that excellent health care and excellent therapy was facilitated through my personal health insurance. Then a few years before that, in 2015, my oldest daughter was diagnosed with scoliosis. And she had to have surgery with rods and screws placed in her spine to correct the curvature. That procedure was made possible through my husband's health insurance. So, Madam Speaker, if I were to say how we were able to access hundreds of thousands of dollars in health care on a personal level, it was through access to health insurance. We would not have been able to, Madam Speaker, my husband and I, afford those exorbitant medical bills if it were not for access to health insurance.
Every Bahamian should have.
Yes. So, Madam Speaker, if anyone understands the importance of access, it's me, standing here, the woman who they say would never walk again.
Yes.
And I would not be standing in this honorable house to second this important compendium of health bills. So yes, I support universal health care because I believe all Bahamians, every Bahamian, should have the same access that I enjoy. Healthcare is a foundational pillar of human rights, human dignity, equity, and national progress. The state of a nation's healthcare system can tell you a lot about the way it views its people. When the privileged have access to quality health care while others suffer, that tells you something about a country.
Yes.
It speaks to our priorities, Madam Speaker. It speaks to whose interests are being represented and pursued. It speaks to how a nation views those at the top versus those at the bottom. And Madam Speaker, I don't believe anyone will look at the state of our local healthcare system as it has existed over the past few decades and claim that this is the best we can do for our people. And I'm not talking about the doctors and the nurses and the technicians and the other hard-working healthcare professionals who also use the system and suffer in the system. This has been the critique, Madam Speaker, for decades because of neglect and policies that we are working on today that don't do enough to bridge the gap in our society. But fortunately, Madam Speaker, this Davis administration is committed to moving our nation in the right direction on healthcare, building a system based on access, equity, and quality, Madam Speaker. The gaps in our system are well known. In fact, in Golden Gates, my beloved Golden Gates, I found it important to introduce our own solution to account for the gaps. And in partnership with the Golden Gates' son, Dr. Don DeVoe of Oak Tree Medical, we launched the Golden Gates Health Insurance Program, a group insurance program that provides affordable access to quality care for my constituents. This comprehensive program includes physical examinations, laboratory services, imaging services, including mammograms and screenings, specialized services including pap smears, prostate screenings, colon cancer screenings, bone density tests, ECGs, mental health screenings, nutrition and dietary advice, pharmacy services, surgical suites, rehabilitation and physical therapy, urgent care, and other in-demand medical services, all for the people of Golden Gates, because I understand that access to healthcare is so important for our people. I've also directly assisted many constituents with access to vital healthcare services facilitated through the Ministry of Health and Wellness, and I want to personally thank the member for Tall Pines for his support in that regard. Madam Speaker, in Golden Gates, we're proud of the work we've done to bridge the gap and break down the financial barriers that prevent people from getting diagnosed and treated. But Madam Speaker, I look forward to the day when these kind of community-led healthcare initiatives aren't even necessary anymore. A day when universal healthcare is available and healthcare is a right that all Bahamians have equal access to. And that's why we're here today debating this compendium of healthcare bills. It's taking the vital steps in the right direction. These 5 bills will provide us another major leap forward towards our healthcare goals. So there's the National Health Insurance Bill 2025, which replaces the 2016 Act and will now provide standardized access to health care for all Bahamians. Every private insurance plan must provide a standard health benefit that matches NHI coverage, ensuring consistent primary care and quality across all insurers. Whether you're living in Nassau, Grand Bahama, Andros, Abaco, Eleuthera, Exuma, Meguana, Inagua, South Beach, Nassau Village, St. Barnabas, U2, Baintown, Yamacraw, Marathon, or Golden Gates, you will have access to identical standards for coverage, which will ensure you have access to preventative care, diagnostic services, and needed treatments thanks to this bill. And I can't forget Bamboo Town. Then, Madam Speaker, we have the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill 2025. This will merge the existing prescription drug program with NHI, expanding coverage to over 161 people. And I know there are Bahamians right now. I can think of one, you can think of one, we can think of many who are struggling to afford insulin to control their blood sugar levels, who desperately wish the prescription drug plan applied to them. Well, thanks to this bill, they will have the opportunity to get free medication under this plan. The same goes for those suffering from rheumatoid arthritis, lupus, asthma, COPD, high cholesterol, breast cancer, prostate cancer, epilepsy, glaucoma, high blood pressure, and heart failure, among other specified chronic diseases. Madam Speaker, it's no secret that mental health is a big deal for me. Wherever I can, whenever I can, I have been and continue to advocate for mental health and promote awareness of mental health issues, including encouraging those who may be experiencing mental illness to receive treatment. The problem is, it's difficult to gain access to these treatments when you don't have a lot of money. Madam Speaker, that's another reason why I launched free mental health counseling in Golden Gates, to remove the financial barriers for those in the constituency who are in need of counseling. So I'm very happy to see that this bill also allows for free psychiatric drugs for those in need of medication to treat their mental illness. Madam Speaker, this will make a big difference for someone, and I can think of a few, who are able to live meaningful, productive lives with the right medications, versus that same person being unable to just hold a job or thrive independently because of untreated medical illness. So access to medication can be the difference for that person, which we now provide. I encourage all eligible Bahamians in need of prescription mental health medications to take advantage of this opportunity when it becomes available. Madam Speaker, I'm also pleased to see that we're debating the Health Promotion and Wellness Bill 2025, which is greatly needed. They say prevention is better than cure. With the creation of a national health promotion and wellness plan, we will be able to educate and support our citizens in leading healthy and prosperous lives. Many of the most common diseases that affect our quality of life place financial strain on families and ultimately lead to early deaths are preventable, Madam Speaker, if only we're willing and able to make the right dietary and lifestyle changes. There's so much conflicting information out there, and people are busy, people are stressed, they're pressed for time, and we tend to make health decisions based on convenience or based on familiarity and preferences. Widespread education is needed. Cultural change is needed. And most of all, access and support are needed. Madam Speaker, this bill provides all. Community education and workplace wellness initiatives will help us to break the cycle of chronic disease that has plagued our communities for generations. Limits on harmful foods and warning labels will make it easier to make the right choices, and a fully empowered National Food and Nutrition Commission will drive the necessary change to make it all happen. The Health Promotion and Wellness Bill represents a paradigm shift from managing illnesses to promoting wellness and preventing diseases. Madam Speaker, oral health is also addressed by this compendium. And when we talk about health, we don't often discuss oral health, but oral health is absolutely essential to our well-being. This bill establishes modern standards that protect patients while supporting dental professionals in delivering exceptional care that meets international best practices. Through this bill, we are providing clarity for our practitioners while ensuring our people get the best quality dental and oral care. Finally, Madam Speaker, the fifth bill before us today is the Pharmacy Bill 2025. Modern healthcare demands modern prescription practices that prioritize accuracy, efficiency, and patient safety through technological innovation and systematic quality control. This bill brings our pharmacy regulations into the digital age, as this government is doing with many processes across the platform, enabling secure electronic systems that reduce errors, prevent prescription fraud, and improve medication management for patients with complex health conditions. Madam Speaker, taken together, these bills represent real progress for our healthcare system, and you know Pia loves progress. Most importantly, real progress for the people. Everyone who makes use of healthcare in the Bahamas, and Madam Speaker, I believe that that is everyone. All of us, Madam Speaker. Every single person in the Commonwealth of the Bahamas will benefit from these changes. We are fundamentally transforming healthcare for tens of thousands of Bahamians. And Madam Speaker, it was the PLP that first launched national health insurance. And now it's the PLP that is taking us one step closer to the goal of universal healthcare coverage for every Bahamian. Madam Speaker, the Progressive Liberal Party has always stood as the party of progress, the unwavering champion of access for all Bahamians, and the voice of those too often ignored by the political elites who forget their responsibilities when they come into office. But we didn't enter office on September 16, 2021, just to make big promises, Madam Speaker. We're a government of action. Member for South and Central and South Eleuthera say, just results, just motion, just road, Nassau Village. A government of solutions, a government of transformation, a government of progress. We promise to take on the big problems, and we are delivering. Whether we're talking about energy, the economy, labor and public service reform, education, or healthcare. We have laid a foundation that will stand the test of time. Yes. Today, Madam Speaker, with this compendium, we add to the long, long list of transformative policies implemented by this Davis administration with 5 bills that will measurably improve lives and build a healthier nation. Madam Speaker, Golden Gates proudly seconds this compendium of important bills for the people. And may God bless the Commonwealth of the Bahamas and keep us all healthy. Yes. Thank you, Madam Speaker.
Thank you, Honourable Member. It has been moved and seconded that the following bill be read a second time. and committed. A bill for an act to continue the National Health Insurance Plan and fund is established and existing under the National Health Insurance Act 2016 to extend the benefits under the plan and to provide as a minimum standard health benefits and other benefits to persons presently enrolled in the plan and to persons eligible and enrolled after the commencement of this act. To validate all acts done under the existing plan and fund, to repeal and replace the National Health Insurance Act 2016 and for connected purposes. As many, the chair recognizes the honorable member for East Grand Bahama.
Thank you very much, Madam Speaker. Madam Speaker, I rise again in this honorable place to speak on behalf of the good and the special people of the East Grand Bahama constituency. I am grateful to God and grateful to them for providing me with this opportunity to be able to represent them in this honorable place. Madam Speaker, I also rise to give the support of the opposition to the National Health Insurance Bill and to the other compendium of health bills, and to contribute to this important debate. Madam Speaker, while we hold the government to account on its execution, we acknowledge that this bill reflects a continuation of work by the Free National Movement and an evolution of the policy principles laid down under the Free National Movement's administration. The 2016 NHI Act focused on establishing a basic package for health services. The 2025 bill expands the framework into a more robust platform for universal health coverage, financial protection, and service quality. This expansion directly mirrors the intent of the shared responsibility paper that was produced under the FNM, and that was during the period of time between 2017 and 2021, which envisioned not merely access, but equity, sustainability, and also the quality in service. Madam Speaker, the member for Golden Gates, I think, was absolutely correct in that I think all of us have been touched by some health issue. All of us know someone who has been touched by some health issue, which makes what we do today here that much more important. My eldest brother passed away a few years ago from cancer. And I myself have had a, thank God, a scare, only a scare, with respect to colon cancer as well. So all of us, I believe, take this bill and take these bills extremely seriously. And healthcare really, you know, as was, I think it was said on a number of occasions by the member for Kalani, that healthcare is one of those topics that we should very rarely deal with it on a purely political level, because it is so important and it really affects so many of us that we really should look at it in terms of the national interest. The bill, Madam Speaker, broadens the scope and is therefore, is not, I would suggest, not a new policy, but really it advances the existing policy that was there. It was started in 2016, built on after 2016, built on between the years of 2017, 2021, and now we are expanding the coverage, particularly with the National Health Insurance Bill. The approach to defining, expanding benefit packages, stakeholder consultation, and greater transparency is also consistent with the Free National Movement's policy position. While we in the opposition support the general direction of this bill, we must express our concern on certain issues. Madam Speaker, we don't believe that the bill goes far enough in addressing one of the greatest health and financial threats facing Bahamian families. And this threat really is the treatment of cancer. The bill speaks about the screening for cancer, but we don't believe that it goes far enough in terms of the actual treatment of cancer. Madam Speaker, the paper that I was referring to, which was produced under the F&M by the technical professionals, and I have to applaud the technical professionals of the National Health Insurance. The paper was produced by them, but it was produced during the time of the Free National Movement. They had a term called a high-cost care program, and they had recommended that this high-cost care program also be approved, but it was unfortunately not a part of this bill. It was called, the document was called the Shared Responsibility Policy Paper. It clearly articulated the need to expand the national health insurance to include coverage for high-cost conditions such as cancer, end-stage kidney disease, and cardiac events. The document acknowledged the devastating financial impact these illnesses have on Bahamian families and positioned the high-cost care program as a critical phase in national health insurance. Cancer is not some distant or abstract policy issue. It is a devastating reality in nearly every Bahamian home. All of us in this house know someone who has fought this battle. Many of us have lost loved ones to it. It is a disease that strikes sometimes without warning, and when it does, it often brings not only pain, but desperation and tragedy. Cancer is a leading cause of catastrophic health expenditure in the Bahamas. So why does the bill stop short at screening alone? That is, we would suggest, simply not enough. If the purpose of this legislation is to truly financially protect and provide equity, then we would suggest that cancer treatment must be included, clearly and explicitly and boldly. This is a matter of what we would call moral responsibility. We cannot say that we are building a universal health system while turning a blind eye to the single most ruinous medical cost our people face. A specific provision of this bill or its regulations with defined treatment benefits and reasonable financial limits. So obviously if you extend it to cancer treatment, you will have to limit the cost of it, limit the financial cost of it. We believe it would bring legal certainty, promote health equity, and send a powerful message to every Bahamian fighting this disease. You are not alone, and you are important enough to act on. Madam Speaker, we also cannot ignore the looming threat that lies beneath the noble promises of this bill. A bureaucratic tsunami that could bury the very people that we are trying to help. Let us be honest. Our public health system already struggles under the weight of understaffing, inefficiencies, and delay. Patients today, even with private insurance, and I've had this in my own experience, patients today, even with private insurance, often face agonizing waits for pre-approvals, sometimes days, even weeks, for a test or essential treatment. Now imagine adding over 100,000 beneficiaries, many seeking new services that may also require pre-authorization and case management. Without urgent and deliberate preparation, we are inviting chaos. Madam Speaker, are we sleepwalking into a bureaucratic nightmare? The government must not simply hope for the best, it must be ready with expanding staffing, upgraded systems, and bold administrative reform. Madam Speaker, also, no Bahamian must be left behind, not in Grand Bahama, not in Inagua, not in Auckland. This bill will be meaningless for many if the government does not ensure that the family island residents and those in Grand Bahama have full, equal access to the promised extended benefits. If the government cannot guarantee access to these services where people live, then it must be prepared to fully cover the cost of airfare, accommodation, and ground transportation for every NHI patient forced to travel for care. The bottom line, Madam Speaker, is in the family islands and in Grand Bahama, some of those pre-screening services may just not be there. Some of the extended benefits that the bill promises, the services to provide those treatments are just not there. We, in East Grand Bahama, provided, every year we provide mammograms. And we, I believe it was the first year we provided mammograms, we could not use the RAN hospital to provide the mammograms. And it just took, just took too long for the other private clinics to provide the responses from the mammograms. So thankfully, Doctors Hospital partnered with us and actually flew the residents from East Bahama to Doctors Hospital for them to be able to get the mammograms and to get the responses in a timely fashion. And Madam Speaker, one of the residents of East Grand Bahama who we sent to get the mammogram, unfortunately, the result of the mammogram showed that she had breast cancer. And again, because she got the mammogram, they were able to start the early treatment. She did go through a period where it was touch and go, but thankfully, she is doing well today. But again, the bottom line or the message that we are saying is the facilities have to be in place to accommodate the added and extended benefits. And if they are not, then we will have to add the additional costs to fly people in, to provide accommodation for them, transportation for them, food for them, while they are in New Providence. Otherwise, Madam Speaker, we are simply entrenching into a two-tier system, one for Nassau and one for everyone else, which obviously no one wants. The success of this bill, Madam Speaker, will not be measured by the headlines, but it will be measured by whether the woman in High Rock, the woman in Freetown, Grand Bahama, East Grand Bahama, can get a mammogram without having to sell bake sale tickets to fly to Nassau. This is the true test of national health insurance. Equity, not just in law, but in access, in dignity, and also in reality. There's also, Madam Speaker, a very significant and pressing challenge that must be confronted head-on. Ensuring the National Health Insurance Program has the resources it needs to meet the surge in demand that the bill will create. This cannot be overstated. Doctors and providers who already rely on national health insurance will now be depending on it even more heavily. And many new providers will enter the system with national health insurance as their primary or sole source of income. So, for example, you have a lot of doctors who are using or who are a part of the national health insurance system. We are now adding additional benefits, which means that even more doctors will also be relying on this system. And those doctors who already rely on the system will be relying on the system even more to provide their income. In effect, some of our private sector health professionals may become de facto public servants. And yet, Madam Speaker, this government already struggles to pay them. The government already has challenges with respect to paying doctors on time. And the doctors wanted us to make that point and to emphasize this point. Doctors and nurses and those health professionals that are a part of the clinics that are a part of NHI. Doctors are waiting weeks, sometimes months, to be paid for services already rendered under the current NHI scheme. Clinics are struggling while there are government delays. What then will happen when the system is suddenly expanded to cover new services, new patients, and new providers? The answer, Madam Speaker, we hope is not chaos. The government is already behind, and it cannot afford to fall further behind. This issue must be fixed, and it must be fixed now. If the financial pipeline is broken, if doctors and nurses can't be paid on time, then no amount of promises in law will deliver real care in the community. This is not just a technical glitch, it is a structural failure waiting to happen, and it must be resolved before implementation proceeds any further. Madam Speaker, just briefly on the Health and Wellness Bill of 2025. At the outset, let me say that we support this bill. We are not at all, have no opposition at all to the contents of what is inside this bill. And again, as was said by the member for Tall Pines and the member for Golden Gates, we agree with a lot of what was said with respect to this bill. But at the outset, we must ask a fundamental question. What is the mischief that this bill seeks to cure? Because when we examine the text closely, I believe that, or those of us on this side also believe, that there is nothing in the bill that cannot already be done under existing legal authority. All of the things that were spoken about by the member for Tall Pines, the member for Golden Gates, can already be done. The law already provides for these things to be done. Or indeed, is not, or either you can do it, or is already being done. So the stated goals of promoting healthy lifestyles, reducing non-communicable diseases, coordinating food and nutrition initiatives, and implementing public health policies are all good. These are all policies that the government wants. These are all policies that the opposition wants. We are at one with respect to these policies. They are all good. But they are also well within the current scope of the Ministry of Health and the Public Hospital Authority and existing interagency framework. There's no apparent legal barrier today to running a wellness campaign. There's no barrier to doing that, no legal barrier to doing that. There's no legal barrier to improving school health nutrition. No legal barrier to doing that. There's no legal barrier on adopting a global best practices in the public health. These are all policy decisions that they support and we support. So what then is the necessity to codify this into statute? We should be cautious about passing laws just for the sake of passing a law, or to make announcements that sound bold, but really in reality do little to change. In my view, laws should respond to specific problems, not duplicate or repackage existing mandates. And if this bill is not about empowering new tools, then we must ask, what real change will it deliver? And is legislation truly the vehicle we need to achieve it? What we have before us, Madam Speaker, again, is something that we, again, like I said, we all can agree with and we all can support. Madam Speaker, unfortunately, though, in the bill, there are no mandates. There's no clear penalties for non-compliance. There's no product bans, no regulatory teeth to compel change. How would, and I would like to understand, how would labeling work? Because if we have packages that come from the US and they come directly from the US into our food stores, how would repackaging or relabeling work? Maybe somebody on the other side can tell us how that would work. We've also been talking for years about fiscal measures like VAT-free, healthy food. The member for Tall Pines has said they have moved beyond breadbasket items. So have we. We say, take VAT fully off all healthy food. That's the position that we have moved on from. Yet this bill, and there is no, I can stand here and say, there is no dispute from me on this side, because that is something I have been saying on behalf of the opposition for several years. For several years, we have been saying, take VAT off of all healthy food. All of us believe the same thing. Madam Speaker, we have been talking for years about fiscal measures like VAT-free, healthy food. Yet the bill merely allows recommendations. You can do, and you can do that now without the bill. So the bill speaks about the Commission and the Ministry of Health can make recommendations to the Ministry of Finance. There's nothing preventing that from happening right now. In fact, that should have been happening years ago. That when there was a health and wellness program that was established, that health and wellness program ought to have been making recommendations. And I believe, I will give the member for Tall Pines the benefit of the doubt, that I believe they have been making recommendations from health perspectives. So that part of the bill, again, I don't know if that moves the needle much. The bill also doesn't mandate or detail the concrete fiscal policy. We control, right now, Madam Speaker, we control things like school cafeterias. We control the property on schools. We control school vendors. We control government buildings and hospitals. Why then are we not mandating nutrition standards for what is being sold and what is being served on government property. We have that power today. As simple, Madam Speaker, as what is served in the Parliament. I love the food that is prepared in Parliament. They are doing an incredible, amazing job with the food that is being prepared in Parliament.
3 meats.
The vendors do an amazing job. Let me say that at first. Let me say that so there's no mistake. They do an amazing job at preparing the food.
Fruits and salads. Very good.
But Madam Speaker, correct. But couldn't we start here by looking at the standards of nutrition, the standards for salt, the standards for sugar, sweet drinks, sodas?
Bring more watermelon.
Couldn't we start here? That if we want to truly make a dent in terms of nutrition standards and health standards, couldn't we just start here? Because these are the things that we actually have control over. Do away with the donuts. and you know, do away with some of those things. Madam Speaker, I wonder if I can get a lot of support on that one. But again, Madam Speaker, if we want to be serious about this, then we really can there are some things that we don't need the law to do. There's some things that the government can do immediately. And personal. There's some things that we can do personally as well. But, Madam Speaker, it would begin by regulating, even with the government in terms of what it purchases. The government has tremendous purchasing power. But the government can look at regulating what it purchases and what it sells. That it will only purchase certain items because there's nutrition in these items. It will only sell certain items because there's nutrition in these items. You know, you have something as simple as vending machines. If we want to do away or we want to reduce sodas, a good place to start may be taking the vending machines that sell sodas out to hospital.
The hospitals, yes, sir.
That may be a good place to start. The vending machine, if there are vending machines in government buildings, vending machines in other places that the government controls, you could just take those things that you do not want, just remove those things and replace them with more healthy items. Madam Speaker, a real wellness law would require the public sector to lead by example, which includes feeding our patients nutrition foods, and I'm sure that the hospital does that, setting clear targets for sugar and salt and holding those violators accountable. That could have been put in the bill in terms of certain standards and holding those persons who violate those standards to account. Madam Speaker, as I close, there's a member of my constituency, and they are also a health worker at the Rand Memorial Hospital. And they've given me something to read, and I wanted to read, and I also want to adopt what is being said. The Rand Memorial Hospital is in dire need of urgent attention. From the worn-down aesthetics to the critical shortages in equipment and medication, the facility has been operating on fumes with minimal resources. This is not an attack on the hospital's administrative team or the Public Hospital Authority, as they continue to do what they can with the little that they've been granted, navigating the system assertively and navigating the system responsibly. But the situation is beyond restraint. There's a severe shortage of nurses, despite recent efforts to hire foreign nurses, many local staff have left, not out of rebellion, but out of necessity, searching for better working conditions and sustainable quality of life. The cost of living in the Bahamas is already high, and the healthcare professionals continue to work tirelessly with minimal support. Basic supplies and bed spaces are in short supply. Patients remain in the emergency department for days due to the lack of inpatient beds. To make matters worse, the morgue project has been stalled for over 2 years with no clear resolution or visible plan for completion. There are also very few medical specialists that are on the island, as most have their, Madam Speaker, can I just, thank you, as most have either relocated or remained at Princess Margaret Hospital in Nassau. It is disheartening to witness the Round Memorial Hospital, a hospital, being treated like a mere clinic. The people of Grand Bahama deserve better. So do the doctors, nurses, and support staff who continue to serve under these impossible conditions. It's time for real solutions, not more promises. And Madam Speaker, I wish to thank that person for providing me with that information and also adopt what is being said. Madam Speaker, as I said, those of us on this side, we support these bills, particularly with the national health insurance. Between the time of 2017 and 2021, under our administration, we did work. Governments are continuous. This is a continuation of the hard work that was done by those professionals, the national health insurance professionals. And this is one where we on this side, we 100% thank them and support them for their continual work. And a lot of them are, they continue through administrations. So we support what the continued work that has been put forward and the continued work that has been done. Thank you very much, Madam Speaker.
Thank you, Honourable Member. Asmini. The chair recognizes the Honourable Member for Cat Island, Rumkey, and San Salvador.
Thank you, Madam Speaker. Madam Speaker, I stand as usual in this House on behalf of the hardworking people of Cat Island, Rumkey, and San Salvador, whom I have the esteemed privilege to represent. I want to say to the Minister of Health that I am very pleased in the efforts that he's exerted in resetting and righting what I call the healthcare ship. It's taken a lot out of him, and I'm aware, and he has stayed very focused and tireless attention to transforming the healthcare center as we promised to do. And I must say that it's well on the way. Well done, Member of Parliament for Tall Pines, Minister of Health, in the person of Michael Darville. And today, Madam Speaker, I can say to my constituents and to all Bahamians across our archipelago, with confidence and with no small amount of gratitude, that the legislations before us will promote their health and their well-being and help our country take important steps forward in building the healthcare system that Bahamians deserve. We have spoken in this place and elsewhere, of our administration's priorities: security, opportunity, affordability, and reform. We are working to strengthen our country's national security and to build safer communities. We are working to expand opportunities to build a more inclusive economy, infrastructure improvements, and new programs in agriculture, and innovation in education and training are all important ways we are investing in our country and in our people to ensure that opportunities are expanded. We are working to make life more affordable in the Bahamas. Following a global inflation crisis, which increased the already too high cost of living here. Madam Speaker, we are also working to bring much needed change and reform to many areas. Although fixing broken systems, whether in energy or in land registration or healthcare, that doesn't happen overnight. But when you want to truly change the status quo, when you want to change lives, you must get the details of your reforms right, and you must be in it for the long haul. That is what we have worked hard to do in healthcare, acting to provide immediate relief when possible, but also building comprehensive, transformative changes. I don't think many Bahamians have forgotten the state of things in September 2021. We inherited a healthcare system in deep crisis with severe challenges across multiple dimensions. Of course, these challenges were compounded by the pandemic, but the crisis was also the result of long-standing structural deficiencies. The capacity of our system was overwhelmed to breaking point. We have made substantial progress, but it has required several years of work to put in place the most important building blocks for change. And we are now able to address with great urgency the clear deficiencies in the system. The healthcare compendium of bills before us today helps us to take another step in the right direction. The healthcare compendium of bills embodies the fundamental values that have defined this administration since day one. Fundamental PLP values that have defined our party since its inception.
Yes.
We believe in equity.
Yes.
Simply put, that quality health care is the right of every Bahamian, regardless of which neighborhood they live in or the amount of money is in their bank account. We believe in accessibility. A nation made up of many islands will always face resource and logistical challenges. But we do not accept that geography must forever determine health outcomes. We also believe in prevention because investing in wellness today prevents illness tomorrow. We see investments in healthcare as investments in the potential of our people. It is difficult to thrive while battling illnesses. So here again, as in so many areas, we have refused to accept the status quo. Instead, we have laid a foundation for transformation. Madam Speaker, the Bahamas faces significant health challenges that demand action. Non-communicable diseases such as diabetes, hypertension, and heart disease represent our greatest health burden, surpassing communicable diseases as the leading cause of illness and death. Healthcare expenses have bankrupted many patients and their families, and public facilities continue to struggle with overcrowding and long waiting times. This reality is unacceptable, in a 21st century Bahamas. That is why, with each year of this administration, despite the many other urgent challenges requiring investment and focus, we have made consistent progress in taking on long-standing health care challenges. We established the Catastrophic Healthcare Fund, providing support to those facing serious illnesses. We've embraced modern electronic health records with telehealth capabilities, bringing technology to Bahamian healthcare. We have increased salaries and benefits for our nurses and doctors, valuing the hands that heal us and the voices that comfort us in our most vulnerable moments. Mental health has always been prioritized through amendments to the Mental Health Act. In fact, we passed a new act because psychological well-being cannot be separated from physical health. Our healthcare infrastructure investments speak to our commitment. We are constructing new hospitals in Grand Bahama and New Providence, renovating clinics across almost every populated island, and implementing improvements at Princess Margaret Hospital. These are real ongoing projects, some of which are already operational and providing improved health care to patients. Others are under construction and will be making a difference to Bahamian families in short order. The compendium we are debating comprises 5 bills, each addressing a different area of healthcare improvement. Before us, we have the Health Promotion and Wellness Bill 2025. This foundational bill establishes our commitment to preventative care. We are laying the groundwork for a national health promotion and wellness plan with measurable targets, moving us from reactive to proactive healthcare. For the young Bahamian who has been warned they are pre-diabetic, this means the ability to participate in community education programs that teach proper nutrition and exercise. For the busy parent, it means workplace wellness initiatives that prioritize physical and mental health. For our children, it means school programs that establish healthy habits from an early age. The bill empowers the minister to set limits on harmful foods and require warning labels, providing information to Bahamians about the ultra-processed and harmful food products that fuel our chronic disease epidemic. Additionally, the establishment of a National Food and Nutrition Commission will ensure our food environment supports health rather than undermines it. Nobody loves Bahamian food more than me, Madam Speaker. But we can embrace vegetables and fruits, especially the ones we can grow here at home, and make sure we enjoy our fried foods and starches and sugars in moderation, of course. This bill represents a paradigm shift from primarily focusing on treating illness to promoting holistic wellness and healthy lifestyles, a shift from individual responsibility to community support, and a shift from managing disease to preventing it entirely. Madam Speaker, the Pharmacy Bill 2025, another important bill in this compendium, takes a big step in the right direction, this time in relation to how we process prescriptions. Modern healthcare requires modern prescription practices. This bill brings our pharmacy regulations into the digital age, allowing secure electronic prescription systems that reduce errors and prevent fraud. We no longer need to rely on the old paper-based process. Sometimes it is a near miracle that our pharmacists can recognize the handwriting or the handwritten prescriptions that are brought to them. There are times when they have to call the doctor just to figure out what was written. With the new system introduced by the Pharmacy Bill 2025, we no longer have to risk potential medication errors due to handwritten prescriptions. Electronic prescriptions ensure accuracy and create clear records. And this includes integration with our cannabis database so that as we roll out our new regime, it will benefit and improve efficiency and accurate record keeping as we balance access with safety. These technological improvements will reduce wait times, improve safety, and support our healthcare providers with tools that match international standards. In this compendium, we also have the Dental Professions Bill, which establishes new national standards for dental practice. Any oral healthcare professional will tell you that oral health is integral to overall health. Yet dental care has been inadequately regulated for years. This bill establishes modern standards that protect patients while supporting dental professionals. Standards are established for the qualifications to be registered as a dental professional, and areas of specializations will also now be recognized. The strengthened Bahamas Dental Council will ensure transparency through annual public listings of licensed practitioners. Mandatory continuing education requirements guarantee that practitioners maintain up-to-date knowledge and skills. And formal disciplinary processes will protect patients from misconduct while ensuring the fair treatment of professionals. Bahamian families can now have confidence that their dentist meets the highest professional standards, and dental professionals will now have clear guidelines and support for their personal development. Next, we have the National Health Insurance Bill 2025, which repeals and replaces the 2016 Act, adding expanded coverage and stronger oversight. This comprehensive bill introduces a revolutionary framework that ensures every Bahamian has access to quality health care. Through extensive stakeholder consultation with the Insurance Commission, the Bahamas Insurance Association, the Chamber of Commerce, the Medical Association, we have crafted legislation that balances universal coverage with systemic efficiency. The centerpiece of this transformation is the establishment of a minimum standard of coverage, referred to as the standard health benefit, which mirrors the care provided by national health insurance. Every private health insurance plan must provide this minimum standard to Bahamian residents, ensuring that regardless of your insurer, you receive consistent, quality primary care. For the working mother in Nassau who receives insurance through her employer, this means her coverage will include the same comprehensive primary care services as her neighbor who relies on NHI. The businessman in Freeport and the teacher in Andros will have access to identical standards of preventative care, diagnostic services, and treatment protocols. Under this bill, we are expanding our national network of providers, establishing a unified fee schedule that brings together public and private healthcare professionals under rigorous quality standards. Every provider joining our network must maintain active membership with the Bahamas Medical Council and proper licensing with the Hospitals and Healthcare Facilities Licensing Board. This ensures that whether you visit a private clinic or a public facility, you receive care that meets the requisite professional standards. The bill fundamentally redefines NHI's role, transforming it into what we call an insurer of last resort. This essentially means that Bahamians with private insurance will continue receiving care through their existing providers, while those without private coverage will be served by NHI. However, when circumstances change, for example, when someone loses their job and loses their private insurance, NHI automatically ensures continuity of care. Through required data sharing agreements, we will create a national database that eliminates coverage gaps. No Bahamian will fall through the cracks. When private insurance ends, NHI coverage begins, ensuring uninterrupted access to essential health services. This bill transforms healthcare from a fragmented system where income is a barrier to coverage into a unified system where every Bahamian receives quality care regardless of their health insurance status. This milestone will be achieved with no major increase in costs for the industry or for consumers. And I want to note that our insurance industry stakeholders have supported us on this point. Let me repeat that. Private insurers expect no material increase in costs from our NHI reforms due to the use of efficient provider networks. This demonstrates, Madam Speaker, how comprehensive healthcare expansions and fiscal responsibility goals can be achieved when policies are well designed. After all the years of the critics saying that we could not expand healthcare, all of the people who said that our country couldn't afford it, this administration refused to accept the status quo, and healthcare and the lives of Bahamians will forever be changed as a result of our efforts. Last but certainly not least, we have the National Health Insurance, Specified Chronic Diseases, Prescription Drug Fund 2025. Perhaps no single initiative will impact more Bahamian families than the integrated prescription drug program that will be created by this bill. Amen. I repeat that. Perhaps no single initiative will impact more Bahamian families than the integrated prescription drug program that will be created by this bill. Madam Speaker, over 160,000 NHI members with chronic illnesses will receive free medications and free medical supplies. And that number is up from about 44,000 people under the previous plan. So, Madam Speaker, NHI members, 160,000 of them, will be receiving free medications and free supplies. That number to date is only 44,000. That's why we say this is the single initiative that will impact more Bahamian families with this integrated prescription drug program. Think about the diabetic who currently spends hundreds each month on insulin, money he or she may also need for housing, food, or their children's education. Under our program, these medications will be free. The hypertensive patient who previously skipped doses to stretch their prescription can now access consistent treatment. This program establishes a bulk purchasing strategy that reduces costs for the government while ensuring a consistent supply, and partner pharmacy contracts create a network accessible to all Bahamians, whether they live in Nassau or the most remote family island. These healthcare reforms exemplify our broader transformation of Bahamian society. We are changing the status quo across various sections and sectors that directly impact Bahamians' lives. In Family Island infrastructure, we have broken ground on new airports, upgraded roads, and expanded water systems. Where the FDM left crumbling infrastructure and broken promises, we are delivering modern facilities that connect our islands to opportunities. Grand Bahama's economy is becoming revitalized as we bring in investments, attract more tourists, create an abundance of jobs, and support local businesses. The shipyard expansion, the cruise port, the multiple new resorts underway, and phase 1 of the new hospital will all provide and are providing hundreds of construction jobs and even more permanent jobs. We are making real progress. In the near future, we will be able to proudly proclaim Grand Bahama is back.
The chair recognizes the honorable member for Golden Gates.
Madam Speaker, I move that the House does extend beyond the 1 p.m. hour.
Thank you, honorable members. It has been moved and seconded that the business of this House proceed beyond the 1 p.m. hour. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. The business of this House will now proceed beyond the 1 p.m. hour.
Thank you, Honour Speaker. As I mentioned, in the near future, very, very near future, I suspect even before September, we will be able to proudly proclaim, and East Grand Bahama, you'll be there with me. Marcos is not here today. I hope you'll be there with me when we proclaim that Grand Bahama is back. Across the nation, huh? You anxious for election? Man, I got work to do, man. We got work to do. Like I tell you, we have work to do. And we have done some work and we're continuing to do our work. We still have a lot to do, and we're doing it. Right? So, yeah. He's always with me, so I wouldn't. I'd have to call his name. See, like I didn't call any names over here. He's always with me. So, across the nation, Madam Speaker, reform. Our energy reforms will usher in a new era of solar power while creating a more stable power supply, at the same time reducing costs. Big changes are also happening in education under the leadership of the Minister of Education, the warrior from Engliston. Indeed. And housing, Mr. Bell. Agriculture, Joe Campbell. Tourism, Deputy Prime Minister, and of course, in healthcare, as I pointed out earlier, a priority that we had with Minister Darville, who's doing, Roll Avenue. You from the ball, you descend from the ball field, you know. You are a descendant of the ball field, and that was part of Roll Avenue. And so, as we reject the failed policies of the past and embrace solutions that empower and protect Bahamians, that's what we're doing. Today, we are taking a much-needed step forward for healthcare in this nation. We are transforming healthcare from a privilege to a right, from treatment-focused to prevention-focused, and from crisis-driven to wellness-orientated. We are building the system that the Bahamians deserve. The Progressive Liberal Party the PLP, has always been the party of progress. Today, we reaffirm our legacy through policies that will save lives and build a healthier nation. We are writing a new chapter in Bahamian healthcare. This is just the beginning of the transformation. We have a lot more to accomplish in the coming years, and the best is yet to come. Thank you, Madam Speaker.
Thank you, Honourable Member Asmini. The Chair recognizes the Honourable Member for Central Grand Bahama.
Thank you very much, Madam Speaker. Before I get to the substantive debate, I'd like to, after my speech, I would like to offer my apologies to Yamakra, apologies to the member for Cat Island, St. Barnabas, West Grand Bahama, for not being there to give them that much needed three-pointer that they needed when they played in the basketball game. But I promise you next year, I practice my, so next year, I'll be there to make sure we secure that win. And we will beat the Pastors next year. That's a promise. And speaking about basketball, I'd like to mention once again in this place, Madam Speaker, that the basketball gymnasium at Jack Hayward High School in Grand Bahama is still in need of repairs. It's still offline. The floor is still not down. The AC unit was sitting outside for some 3 years now, and all of the burden is now or mainly on St. George's Gym, and now some shifting to 8 Mile Rock Gym. But for those that need to hear it, who need to act, we need to get the basketball gym at Jack Hayward High School repaired and back online prior to the start, hopefully, of the next school year. Also, the gymnasium at St. George's, the one that is heavily used, there is a leak in the roof, so we need that to be given some urgent attention also. So, Madam Speaker, fellow colleagues, as we are here today to discuss this compendium of bill, I will focus on 3 of the compendium based on time restrictions. I'll focus on the pharmacy amendment bill 2025, the dental professional bill 2025, and the National Health Insurance specified chronic disease prescription drug fund bill 2025. Madam Speaker, these bills are not just legal documents. They are a blueprint. I know you all like the word blueprint. For a healthier, more accessible, and more equitable healthcare system for every single Bahamian. Madam Speaker, the goal today is to highlight their promise, acknowledge areas where we can strengthen them, and of course outline how we can seamlessly integrate them to improve the lives of every Bahamian. Madam Speaker, I'll begin with the Pharmacy Amendment Bill 2025. This bill seeks to modernize how prescriptions are handled, moving us, as was stated earlier, from paper to secure electronic system. Madam Speaker, as Karen indicated earlier, imagine no more bad handwriting. Electronic prescriptions significantly reduce medication errors, making it safer for all of our loved ones. Madam Speaker, e-prescribing will streamline the process, saving time for doctors, pharmacists, and most importantly, for the patients. Madam Speaker, this is also a way to enhance patient safety. When linked with patient records, e-prescription or e-prescribing can immediately flag drug allergies or dangerous interactions. And this is very important because, you know, I have a daughter who has several allergies. And a lot of us have family members as well, as we are exposed to certain allergies. So having these allergies flagged is very important. Acting as a crucial safety net, Madam Speaker, including electronic prescription for cannabis aligns with a modern unified system for all legal medication. And Madam Speaker, while the bill has strength, there are ways that we can make it stronger. And we must surely ensure true modernization. While the bill includes faxes as electronics, fax are indeed outdated and less secure and prone to errors. If you want real modernization, we must focus solely on truly secure, authentic e-prescribing systems and phase out faxes. Madam Speaker, there are some undefined security. The bill uses terms like secure and authenticated without clearly defining what they mean. We need clear, strict security standards for all e-prescribing systems to protect our sensitive health data from cyber threats. Madam Speaker, we need a unified one-stop system. For e-prescribing to truly shine, we need a national electronic health record system. Without it, information can be fragmented, making care less coordinated. Madam Speaker, to make this bill work for every Bahamian, we must set clear security rules, define what secure means with strong guidelines to protect patient information. We must invest in technology and training, provide the necessary funds for digital infrastructure and comprehensive training for doctors and pharmacists, especially, as was indicated earlier, in the family islands. Therefore, no one will be left behind. We must plan a phased transition, gradually move, as I said earlier, away from faxes, giving everyone time to adapt to a more modern e-prescription system. We must start building a national digital health record. This is the ultimate goal for truly integrated and efficient healthcare, Madam Speaker. Madam Speaker, second bill, the Dental Profession Bill 2025, which will, our intention is to provide a brighter and safer smile for all Bahamians. Madam Speaker, this is about bringing our dental care system or standards into the 21st century, ensuring quality and accessibility or accessible oral health care for everyone. Madam Speaker, this bill ensures that only properly registered and qualified professionals can practice, protecting us from substandard care, Madam Speaker, by requiring ongoing education for dentists means that they stay updated on the latest techniques, leading to better treatment for all. If something goes wrong, there are clear procedures for complaints, giving Bahamians a voice and ensuring professionals are indeed held accountable. Madam Speaker, by formally recognizing dental hygienists and therapists, we can expand access to basic dental care services, potentially making them more affordable for all. Madam Speaker, we must identify if there are any weaknesses and suggest ways to make the system stronger. While the bill is strong, we can make this bill even more impactful for the common Bahamian. Madam Speaker, the bill doesn't directly address the high cost of dental care or the lack of dentists in remote areas. Even in the city of Freeport, we have had one government dentist for years. She's overworked. She is stressed, but she's doing her best. We must seek to rectify that situation. We need to explore a tiered fee system structured based on income and incentives for dentists to practice in our family islands, Madam Speaker. While the bill lists licensees, it doesn't clearly state that disciplinary actions will be public. Also, the bill's language can be complex, Madam Speaker. We need easy-to-understand information about patients' rights and complaint procedures and public education campaigns on oral hygiene. Madam Speaker, we must maximize technology at Baintown. There's no explicit mention of online portal for registration or complaints or a framework for teledentistry, virtual consultation that could greatly benefit those in remote areas. To truly bring brighter smiles to every Bahamian, Madam Speaker, we must tackle affordability and accessibility, implement policies for income-based fees, and offer strong incentives for dentists to serve in remote areas. We must boost transparency and education, create public, easily searchable records of disciplinary actions, and launch nationwide campaign to educate on oral health. We must embrace digital convenience, develop online portals for all dental board interactions, and start planning for teledentistry services. Another important thing, Madam Speaker, is that we must involve the community. We must ensure public representation on relevant committees and boards to ensure the voice of the everyday Bahamian is heard. Madam Speaker, I now turn to the last bill, and I promise to be brief. The National Health Insurance Specified Chronic Disease Prescription Drug Fund, Bill 2025. Madam Speaker, this bill is about providing relief and support to thousands of Bahamians living with chronic illness like diabetes, hypertension, and asthma, to name a few. It aims to make life-saving medication more affordable and more accessible. And we talk about how expensive it is, Madam Speaker, to afford the basic healthcare insurance. I was speaking to a constituent the other day who advised me that his office pays some $12,000 at the beginning of every month. $12,000 at the beginning of every month for coverage. Only they're fortunate that they're in a profession where they can afford that. But imagine the common man. And when you go for your medical coverage, the deductible is so high. In some instances, you can't even afford that, to pay that. Madam Speaker, the one-stop management system is a way that we can ensure, or we can say that the bill is indeed strong. Placing this fund, Madam Speaker, under the NHI authority means better coordination, efficiency, and oversight in providing crucial medication. This bill provides broader coverage for more Bahamians. This is indeed, in my view, Madam Speaker, a game changer. It expands eligibility to include our children, very important, our students, the indigent, seniors not otherwise covered, and vital public service personnel. More Bahamians who need help will indeed get it. And I'm hoping that even in this Parliament, our coverage is improved on, and even life after Parliament, there should be some benefits that we should be able to enjoy based on our national contribution. Madam Speaker, this bill will indeed provide more affordable medication. By allowing for bulk purchasing, we can better negotiate prices for drugs or medication, reducing the financial burden on the government and ultimately on all of our citizens. Regular reviews of the fund ensures it remains sustainable and accountable for years to come. Madam Speaker, the bill is flexible because it allows the minister to make regulations and update the list of chronic diseases, ensuring the system remains responsive to new health challenges. And the world is changing, the conditions are changing, and so should our legislation. Madam Speaker, there are ways that we can make the bill even stronger. While this bill offers immense promise, we have opportunities to enhance its impact. The formulary transparency that the member for Tynes spoke about earlier. While a list of covered drugs will exist, the process for how drugs are chosen for the formulary should be very clear and transparent, involving medical experts and patient groups. So you're getting it from both sides. The bill mentions contribution by beneficiaries as prescribed. We need upfront clarity on what these contributions might entail to ensure public understanding and, of course, public trust. While financial reports are crucial, we should also track and publicly, this is important, Madam Speaker, publicly report on health outcomes. Are Bahamians getting healthier? I think East Mama spoke to that earlier. Are chronic disease better managed? This data is vital for continuous improvement. It's not enough to have the fund. People need to know the fund exists and how to access the funds. Very important. We know it exists, and how do we access it? We need a strong public education campaign about the benefits and how to enroll. To ensure that this bill genuinely transforms lives, Madam Speaker, we must communicate clearly. We must launch widespread public awareness campaign to ensure that every Bahamian understands who is eligible and how to access the funds that is available for them. Simplify the process of enrollment. We must establish a clear public and evidence-based process for deciding which drugs are included, ensuring it meets the needs of patients and the providers. We should develop systems to collect data, not just on spending, but on the actual health improvements of beneficiaries to show the true value of this major investment by the government. as I get near to close, Madam Speaker, the strong partnership with pharmacies. We must foster seamless collaboration with all pharmacies and medical suppliers, ensuring a smooth and efficient distribution of medication across the country. And Madam Speaker, these 3 bills are not just about legislation, the 3 that I'm mentioning out of the 5. They are not about legislation. These bills are about people. They are about peace of mind for patients knowing their children, or for parents knowing their children prescriptions are accurate and safe. Confidence in knowing that our dental professionals are highly qualified and accountable. Relief for families burdened by high costs of life-sustaining medication for chronic illnesses. By embracing the strengths of these bills and proactively addressing their areas for improvement through clear regulation, strategic investment, and robust public engagement, we can ensure they are seamlessly integrated into our society. What does this mean? Investing in digital infrastructure, modernizing our system for efficiency and security, prioritizing access and affordability, ensuring quality care is not a luxury, but a right for every Bahamian, regardless of where they live or what their income might be. So where they are from Carolina and Old Bight, or they're from Odell Corners, it doesn't matter. You are a Bahamian and you have a right to coverage. We must champion transparency and public education. Empowering our citizens with knowledge and trust in the healthcare system is a must. This is a commitment, Madam Speaker, to a healthier, a more resilient, and more equitable Bahamas. Let us, colleagues, work together to make these bills a resounding success for every single Bahamian citizen. Madam Speaker, having said that, I'm at my 15 minutes mark, and Central Grand Bahama rests and support this bill with the recommendations as made.
Thank you, Honourable Member. The Chair recognizes the Honourable Member for Golden Gate.
Madam Speaker, I move that the House do now suspend to 3 p.m. Seconder.
Thank you, Honourable Members. It has been moved and seconded that the business of this House be suspended until 3 p.m. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. The business of this House stands suspended until 3 p.m.